Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Before we get into today's episode, a quick note from our sponsor. This episode of the Prime Health Podcast is brought to you by Growth Solutions, growth partners for your busy health and wellness professionals. Your biggest headaches, no steady leads, texts that causes tangles in the business, and operations that cut into your time. Here's what we do for you at Grow. We always get you fresh, qualified leads that hit your inbox every day. No feast or famine. One simple platform runs your marketing and follow-up. No duct tape, no price devs. Clear playbooks and automations to cut the busy work so your clinic runs when you are off the clock. Many clients say the same thing before we start. I'm too busy to grow, too slow to scale, and too overwhelmed to fix it. If that sounds like you, hit me up with a DM or anything like that in the show notes. We'd love to be able to help you out. So let's dive into our guest and the star of our podcast today. I'm pleased to introduce you Dr. Yusuf Mathai. As the founder and medical director of Oregon Health DPC, he leads a membership-based practice that prioritizes patient relationships, personalized care, and science-backed vitality programs. Dr. Mathai is especially passionate about helping people reclaim their energy, strength, and longevity using tools like hormone optimization and advanced wellness strategies to support patients living healthier, fuller lives. That sounds like a plan to me. So Dr. Mathai, I want to welcome you to the Prime Health Podcast.
Dr. Barron, thank you so much for having me. I appreciate it.
Absolutely, sir. And you've got a voice for radio and for the podcast. So I'm excited for this.
Thank you.
You're welcome, sir. As I've read through your bio and looked at your website, some of your videos that you've had on there, you're very passionate about your work. Was there a specific moment that happened in your life that triggered you to go down this career path that you're on?
So, the health career path for me goes back to childhood days. I remember I had two things that I really wanted to do as I grew up. And some days I'm still trying to figure out what I want to do when I grow up, right? But one of the things I always wanted to do was be an astronaut, which in talking to my mom, she's like, yeah, that's really not going to happen. So let's focus on some more practical things. Growing up in Kenya, dreams of being an astronaut were probably very unlikely. But earlier on as a child, I got impacted by rheumatic heart disease. And I remember I was about 8 years old when I interacted with this pediatric cardiologist. And there was just something about that interaction that really struck me. And I remember my mom says that I turned to her and I told her with confidence that that's what I want to be when I grew up, and so I always wanted to be a cardiologist when I grew up. Life ended up taking me through a couple of other turns. I still ended up becoming a physician, so I'm a family physician by training, and absolutely loving what I do.
Fantastic. Now, You're a family physician. Typically, most people will say, okay, they're in a clinical setting or they're in a hospital setting. What makes your integrated practice different than a typical medical practice that most people hear about?
So I think one of the big things is, and I always tell my patients, I always tell the physicians, I'm no smarter than the other doc, right? But one of the things that we are able to do through our practice is we have time. And that's one of the things that's unfortunate, is that most healthcare practitioners just don't have time. They don't have time to listen to their clients. They don't have time to try and figure out what's going on. And so through our concierge model, we have time. We're really able to sit down with our clients and hear the stories. And when you really get the patient's story is when you can really, really try and figure out what's going on. I remember in my training, one of the attending physicians always told us, 99% of your diagnosis is in the history, right? And at the time I was like, no, let's do this test, but as time has gone on, I really do believe that 99% of that diagnosis is really going to be in that history, really trying to delve in as much as you can, and then using your tests to maybe confirm what it is you thought. And so again, for us, it's really just time that's allowed us to be able to do that.
Yeah. My mother told me at one point in time that, Derek, you have one mouth and two ears. You need to listen better. That was probably because I was talking back to her, more than likely. But that's so true. From a healthcare perspective, it's really important that we listen. They tell us the story, and they reveal the true results that we need to seek. There's nothing wrong with running a test. It helps with our diagnosis. But our patients tell us what is their problem if we're willing to listen. And in a concierge program like you have, which is fantastic, as you said, you do have the time versus somebody that's on a 7 or a 9 minute clock ticker every time they've got to go through with a patient. So that's unfortunate.
It is.
Yeah. So you're in, would you say, the anti-aging longevity market? Would that be correct?
We absolutely are. And have been practicing that actually almost since the onset of the practice in 2019.
2019. Okay. So what do you think are some big misconceptions that the general public thinks about anti-aging or longevity?
Well, I think one of the biggest misconceptions actually comes from my fellow healthcare colleagues who basically look at this space of longevity medicine, functional medicine, anti-aging medicine as being a sham science, and so it's not uncommon when I tell colleagues of mine who are in, regular insurance-based practices, what I'm doing, and they're like, why would you go and practice sham science? And I was like, there's actually really great science about what we're doing. And I think one of the issues is that in regular, allopathic healthcare, which, was part of my training, we are really, really good about, sickness care. But we were never trained with wellness care, which this is what it is, right? It's wellness care. It's how do we take a patient who's not sick, and take them to an optimal space. Whereas on the insurance side model, they're really, really good about taking a patient who's, potentially sick, some life-threatening things, and kind of bringing them back to this baseline, which unfortunately is not optimal most of the times.
Yeah.
And so for me, that's one of the biggest things I've found. I mean, I think as time goes on, the public has been really, really open about longevity medicine, functional medicine. And so really, that's not been the biggest hurdle. It's my colleagues in the healthcare space who have been.
Well, it seems like you're ahead of the race. They're going to be asking you questions as they try and catch up. So good for you. You're on the leading edge for sure. And your patients, I'm sure, are very appreciative of that. So in your practice, Dr. Mathai, what would you say are the top 3 most common patients or conditions that enter into your practice?
So initially, when I started off the practice, like I said, I was a family physician by training. And so we were seeing basically people from cradle to grave, so to speak. But as time has gone on, we've started to focus more on an older population. So I'd say 60-70% of our clients are aged between 40 to 65. And so within that space, and I think part of it is you get to a certain age, you start to realize things are hurting a little bit more than they used to.
We need 5. I can attest to that.
Right? You're like, ooh, where's that knee pain coming from, right? And so for the most part, most of the people who are coming to see us already have a leg up on their health and wellness. They're like, okay, I'm already working out, I'm already doing X, Y, Z, but gosh, I can't lose weight. And that's actually been the biggest one. So this one has been, I can't lose weight, I'm doing everything that I need to do, or I'm tired all the time. So those have been our biggest complaints of people coming into the practice.
Okay. When those people come in, I'm sure you have, it seems like you have people that are actively seeking their healthcare to improve it, but are there some overall health or lifestyle situations that make it difficult for you to treat your patients? Are there certain wrong choices that people are making too often that make it difficult for care in your practice?
In our practice, what ends up happening, fortunately or unfortunately, is that we have a very self-selected group of patients, in part first because, being a concierge practice, they are paying out of pocket above whatever the insurance premiums are, right? And so we have a very health-conscious, health-motivated group of patients who come in to see us. And so there's probably a group out there that will probably benefit from our services that is not coming in. And so again, that's a hard question to answer because again, most of our patients are already coming in, with some wherewithal. I mean, they've listened to podcasts. Often patients will come in, they're like, okay, this is the treatment protocol, I'm thinking about. And so it's our job to sort of be their health Sherpas, and talk a little bit about, okay, this is why this protocol might not work for you, or this is why this protocol might be ideal for you. And so again, our patients are already coming in pre-armed with a lot of education, and they're already doing a lot of the right things. Now, as far as what may be hampering a lot of their progress, I tell them, listen, man, you live in North America. Stress is part and parcel of what's going to happen, and so biggest things, it's stressors, it's life stressors, and trying to mitigate the effects of that. And then two, I mean, as best as most of my patients can, is environmental factors that they may not be able to get away from. So it's water quality, it's air quality, and it's food quality. And so that's where maybe they're making some mistakes. Again, trying to do as best as they can, but not always being able to.
Okay, understood. From the horizon of what's taking place, from what you've seen in patients coming to your practice, what's getting you excited personally, Doc, in regards to what's changing in healthcare?
Yeah, and this is actually going to be quite contrary to some of my colleagues in the healthcare spaces. I almost think about it as the democratization of wellness, where patients now have more tools to be a little bit more empowered in their health and wellness. A couple years ago, it was unheard of or unbelievable that patients could go out and order their own labs, right? And I always thought about that as not being a bad thing, as being a good thing. Why would patients not be able to order their own labs? Yes, they're going to have more questions than answers, and that's kind of where we step in. And so for me, it's actually been pretty exciting. I see a lot of opportunities on the horizon to better help our clients, especially when they have access to tools like that. So lab testing and a lot of other, wearable technologies and things like that, which we've actually integrated into our practice. I was like, oh yeah, fantastic. You have this wearable device at home. It's going to help us collect data at home, which has more utility and value than what we've been able to gather in our office. So for me, that's actually been pretty exciting.
Have you seen the demand for the services that you offer increase in the last 6 months, 12 months?
It's a good question. There's definitely, what I find is there's definitely desire for a lot of people to engage with us, whether or not they do just based on price is something else. But again, when you look at how services like Hims and Hers and Mochi Health have taken off, I mean, definitely there is a demand for some of the things that we do. I mean, we have a pretty thriving weight loss practice, but again, you look at how things like Hims and organizations like that have grown, there is definitely a big demand.
How would you say, like, your practice from a patient perspective? What would you say? How are they finding out about you? Like, how do you, when somebody comes in, do they say, I found you from a referral, I found you from something you did, this video that you did? Like, how are they coming into your practice?
Based on, it's still actual referrals. It's still our clients referring other people to us. We are just recently starting to do a lot more on social media and things like that. But honestly, I think the last 6 years, we've just grown through referrals.
Okay. Mm-hmm. You started at a difficult time. Just little tiny pre-bit before COVID hit. So you've made the 3 years plus past that. So you're going to have a successful practice no matter what. As an entrepreneur, which you have a huge entrepreneurial heart and a spirit in the things that you're doing, as I've read some stuff about you, there has to be the marriage of home practice. What are some of the aspects of the practice that make it difficult for you to run? It's not the same as always having to worry about insurance, checking those, but what are some aspects of running the practice that take up most of your time?
I think for me, the challenge, especially as we've thought about how we scale, is one, trying to, again, first 3 years, the practice was me, I was the practice, it was pretty synonymous, trying to almost divorce that and separate the two out so that I am no longer the practice, or so to speak, the face, because everyone wants to come see the practice wants to come see me, and there is a limit as to that. So that has definitely been a challenge. And then just trying to learn how to work on the practice while working within it. I was talking to, I have a bunch of colleagues who are in the e-commerce space, and sometimes I tend to envy them because, say I have a friend who owns a company that sells golf equipment, right? He's not physically making the golf equipment. He's not physically out there doing sales. He was initially, but not anymore. Whereas I'm still very much a part of the practice, producing within the practice, seeing clients, and then still trying to run it. So that's been a challenge, but again, it's one that we're working through. So that's definitely been one of the things that's been a challenge.
Are there growth opportunities that you see, whether it's locally, regionally, nationally, that there have been things that maybe you are wondering on how you can capitalize on them, like how some other physicians have done in practice? Is there anything like that in your practice?
I think there's a lot of growth opportunities. I think for me, and one of the things we have, so to speak, two things that are really driving us. One is improving our clients' health and wellness, and two is really being an organization that's also about our employees. And I see a big opportunity to be able to create an organization where I can get physicians who are burning out within health insurance practices into a system that will actually allow them to nurture and be healers again. So I think there's massive opportunity on both ends. I think there's also a lot of people who are now waking up to the fact that, I have this health insurance-based healthcare, but it's really not meeting my needs. I need to start looking at other alternatives as to how I'm able to meet those needs. And so I think I'm actually pretty excited about all the opportunities that are coming up. And that's just on a local standpoint. Eventually we want to figure out how we take what we're doing and take it national.
Love it. So you kind of brought up something there as you spoke with some other physicians. So what advice would you give other physicians that are looking to add regenerative medicine, anti-aging, longevity into their practice? Is it a smart move?
I absolutely think it is. Everywhere you turn, you look up things on the internet. It's always leaning towards the regenerative healthcare space. And so I think any physician who is not at least getting, knowledgeable on this is really going to be doing their patients a disservice. And it's not that hard of a tool to add onto your tool belt that you can always reach out to. I think the challenges always will be, within insurance-based practices, it may just be more of a challenge to be able to practice that way, because again, this is the type of medicine that is very hard to practice in a 7-minute window.
Yes.
And so, but again, I think most physicians should at least start to put this into their tool belt, even if they can't advise their patients, even though they can't fit it in with that 7-minute framework. They can be like, hey, listen, I'm at least familiar with what you're doing. You're not going to run into any problems. Oh, hey, there's a practice here that's doing it. You may want to consult them. And so absolutely.
Okay. So you bring up another, because you're a concierge practice, you also run a membership type of a program within a practice. And that's probably a big leap for some of the other physicians that you've talked to, especially in the insurance-based model. But even for your practice right now, if we were able to hand across the screen here you a magic wand, is there one thing that you would wave and some pixie dust comes out and Robin Williams comes out of the jar that's holding you back in the practice, or you maybe see other people that are being held back in their practice and how it could grow?
I think the biggest thing that I would love to see happen would be the shift in the consumer side of things, and maybe that's an education thing that we need to work on, where in America we've gotten so used to healthcare being paid for by quote unquote somebody else. Even though you are paying into those premiums, it always seems like it's an employer who's paying for that. And so most people never want to go beyond what that insurance coverage is. And what I tell a lot of people who come see me, I was like, well, what that is really sick care, right? So yes, you have a policy that's paying for sick care. How well has it paid for your healthcare, so to speak, to keep you healthy and to keep you going? And they're like, oh, yeah. And so for me, I would love if that was the one thing we could change, would be that conception in the minds of consumers to show that, well, you are actually really paying for your healthcare, even though it's not coming out directly. And, are you really getting what you think you're getting out of this? And so kind of helping people make that shift.
Yeah.
Yeah.
And the truth is, for most individuals with insurance right now, they're a cash paying individual to be at the beginning of the year anyways, because they've got to meet their higher deductible. And you have to change that thought process from January, February, March. It just carries out the rest of the year. And if you want somebody that will sit down across the table, knee to knee, flesh to flesh, and say, okay, tell me more about your story. well, wait, you only have 7 minutes? No, I don't. I have the time to help you. And that's what you're doing in your concierge practice. And that's a great point.
Yep, that's what we're trying to do. Yeah.
From a success standpoint, when it comes to patients in your practice, what metrics do you use to show patient outcomes that maybe you couldn't in the general practice?
And so for the most part, I mean, we still use a lot of the same, so to speak, insurance-based metrics. We're still trying to keep within guidelines. And so if we are working with diabetics, we are trying to, at a minimum, get their numbers to where, most guidelines tend to go. But what we often tell our patients, I'll give you a good example with our diabetics, is, well, now your A1C went from a 9 down to a 7, which by most metrics is great. Right. But hey, how about we just try and make it such that you're not diabetic, right? And so those numbers are usually a great starting off point for us. And again, we're using a lot of the same labs, same metrics. And so we say, hey, listen, let's get you to here. Oh, let's see if we can get you further along. So we are doing a lot of population-based health metrics within the practice, but we always try and go a little bit further.
Okay, love it. Always taking the next step. One more rep is always good.
Yes, right.
Yeah. So a question for you, Dr. Mathai. Can you share with us a story of a patient outcome that's just amazing? I'm sure you have a bunch of them, but is there one patient outcome, no matter what the diagnosis was, that you can't believe what really happened in your practice?
Since I graduated from residency 12, 13, 14 years ago, I've never seen it, right? I actually never even saw it in training, right? And I was like, how'd you pick that up? She's like, I don't know. I had time. And so, for us, I think that was just a testament. Again, like I tell people, Dr. McCallum is a lot smarter than me. She would have probably picked it up anyway. But it's that tincture of time that really allows us to do superhuman things, And, the second one that I have, which this one was actually, I think speaks more, again, not to me, but to how our systems are set up and why concierge medicine is set up to help patients succeed. So going back actually probably 2019, 2020, one of my patients who I hadn't seen for a while calls, I remember it was a Monday, she calls, she says, hey, listen, I've been having a lot of acid reflux type symptoms. I've been drinking quite a bit, maybe that's it. And, I spoke to her, I listened, I was like, well, could be inflammation of the stomach lining. We gave a couple of medications to try out. I said, hey, listen, if by Thursday it's not getting better, we'll hop on a phone call. So we hop on a phone call on Thursday. I was like, hey, how are your symptoms doing? She's like, you know what? 90% of my symptoms are better. And every time a patient says but, I was like, okay, what else is going on? She's like, no, but I'm doing much better. And I was like, no, there's a but there. You have a concern. She's like, yeah, could it be something else? I was like, well, you know what? I have an opening tomorrow. So Friday morning, she came and saw me. And she fit the criteria of a woman who's probably having gallstones. And I was like, I think it's gallstones. Let's go ahead and get some imaging done. So Friday, we ordered the ultrasound. She has the ultrasound done on Saturday morning. Come back into the office on Monday morning, get the results. Gallbladder ultrasound negative, something on the liver, something on the colon. And I was like, that's weird. I was like, so I called up. I was like, listen, we find these findings all the time. I'm not particularly concerned. We ordered her a CAT scan on Monday. She had the CAT scan done on Monday afternoon. We had the results on Tuesday morning. And it actually looked like it was a cancer, right? So in the colon, very far away from where she was having the symptoms. Hopped on a phone call with her on Tuesday morning. By Tuesday afternoon, we had a conference call between her, the colorectal surgeon. By Friday that week, we had a tissue biopsy done. By Monday, she was actually getting treated for it. And so, again, I think not for me, I just follow the protocols of, okay, this is kind of what I do next. But I think the one thing we were able to do during that period of time was we were able to help coordinate her care. Because again, we had the time, when I ordered the CAT scan, I actually called up the radiology department and said, hey, listen, this patient needs a CAT scan done. They're like, we have an opening at this time. Cool. Let's get her in. Where I don't think when I was in an insurance-based practice, I would have been able to coordinate that sort of care. I mean, it would have been next to impossible to do that. So that I think was a testament to the system and, a system that worked.
I would say it's a testament to the system. I would say it's a true testament to you and your ethics and integrity. And it's a testament to the fact that you took the time to care about that patient. Not that other physicians don't, but they don't have the time. They just don't in the medical model. And that changed her world. It would have probably taken her a month or two to get around those situations. You were 3 days, 4 days. That's unheard of.
Yeah.
My wife trying to get into somebody today, a month out. It's a very difficult situation.
Yes.
So it's, yeah. So I commend you for doing that. And I'm sure your patient was very happy with the outcome.
Oh, yes.
So where would you like to see your practice in the next 5 years?
Oh, I know exactly where I want the practice to be at. We want to be able to serve as many people as possible. In my mind, I actually want us to be able to serve at least 20,000 people. Again, the goal for me, as far as this practice goes, is to, again, create a space where, I always say that our vision is to build an organization that impacts the lives of our employees and our clients so profoundly that they can't imagine their life's journey without us. And so that's the impact we want to have. Again, it's for the employees, it's for the clients. We want to be able to impact at least 20,000 lives in the next 5 years. And we hope that if we can impact that many people, that then dominoes out as well. Right? And so it's impacting both our clients' lives and our employees. And again, I really keep looking at the physicians that are burning out, and I don't know if there are any good viable solutions within the insurance-based model. There's only so many physician days with physicians getting a pizza as a thank you. That is, that's not going to help burnout, right? We need to be able to help these physicians become the healers that they wanted to be in the beginning. And so again, I really want to create that space for them.
Yeah. I love to hear that. I love to hear somebody that is goal oriented and knows their goal, and you're working towards that. So that's great, Dr. Mathai. So last question here. It's about patient impact and being a differentiator. What I mean by that is, what do you feel your practice and or you do different than anyone else in your community?
That's a good question. What do we do different? Well, for sure. I mean, one of the things, and we absolutely love to do this because we've seen the impact, is the hormonal optimization side of things. We really, really do love to work with clients within that space. Initially, when we started doing this, we were working with a lot of men. And with men, it's easy to get them onto the hormonal optimization side. We found that if we could impact the lives of the women, it had a more profound effect on the family. What I mean by that is women tend to grit through a lot. A man literally will come down with a man flu and he'll be down for the count and he'll be seeking our help, myself included, right? Women just tend to power through. Often when they come to see us, I was like, how long have you had this? How long have you had this fatigue? How long have you had this issue of the weight gain? And they're like 10, 15 years. And I was like, why did it take you so long, right? But once we change the trajectory of their health, their relationships with their spouses change, the relationship with their children, like it impacts so much more, right? And so we've really started to lean a lot more into hormonal optimization for women, actually aged between 40 to about 55. And when we can catch them within that space and really help them, man, it works wonders. And so I think that's one of the things we're really, really trying to do a lot more of, more so than any of the other practices that we've seen around.
Love it. I appreciate that. That's a great future vision for the practice. Now, I'll drop your contact information and stuff in the show notes, but how can somebody locally, regionally, nationally, if they want to get in touch with you, how would you suggest they do that?
Honestly, easiest thing is to call our office, 503-506-8500. A good email is admin@oregonhealthdpc.com. And so either one of those, they'd be able to get in touch with us really easy.
Fantastic. Well, Dr. Mathai, thank you so much for sharing your insights and expertise with us today. Your unique perspective from a family practitioner that jumped into a concierge practice and then developing a membership practice there aren't many that are out there, and the results that you've shown and spoke to us today are amazing. So I appreciate you sharing that with us. For our listeners, if you found today's conversation valuable, please subscribe to the Prime Health Podcast on your favorite platform or here on YouTube as well. And if you thought this was helpful for yourself, please share it, because the message that Dr. Mathai has can help somebody, no matter if you're in Oregon, you're in Idaho where I'm at, or you're in Florida. He offers cutting edge treatments and ideas to help patients get better, and he takes time for them. So until next time, remember that true wellness is a journey we're all on together. Whether you're taking charge of your own health or guiding others on theirs, every step forward matters. Take care of yourselves, and I'll see you next time.
Thank you so much, Dr. Barron. I appreciate you.